Imagine being the parent of a child who has painful seizures and who has to take dozens of pills every day, pills with dangerous side effects. Imagine knowing that access to life-saving medicine was out there, but being unable to access it. This has been, unfortunately, more the norm than the exception since New York rolled out its medical cannabis program, making it the 23rd in the nation to do so. Decades of science has shown medical cannabis to be very effective and safe for controlling the seizures and also lessening the painful side effects of severe illnesses like cancer, AIDS, and many more that are estimated to affect nearly 500,000 patients in New York. Yet, only more than 1,000 have been able to actually purchase medicine. So why might that be the case? As a Tau Fellow at the Drug Policy Alliance, I've been working with Compassionate Care New York, the state's largest grassroots coalition of patients, caregivers, and families. And I've been hearing firsthand from patients who are struggling to access the program. One of the reasons is that the program in New York State is one of the most restrictive in the nation. And this is because of the many hoops that patients have to jump through in order to get medicine. One of the reasons is that the state mandates that patients have to visit and find and visit a doctor who has taken a special training course in order to be able to certify patients who want access to the program. Only then can the patient register online to get an ID card that would allow him to visit the dispensary closest to him in order to get medicine. Unfortunately, patients have been telling us, I cannot find a doctor, the dispensary is too far for me, and once I get there, the medicine is too expensive. So why might this be the case? Firstly, less than 1% of the state's 80,000 doctors have actually signed up to take the training course. Also, there are only 20 dispensaries for a state of 20 million people and 54,000 square miles. Also, because so few patients have signed up, medicine is really expensive and ranges from $300 to $2,000 a month. In the slide behind me, you can see some of the headlines from the start of the program this year that show how hard it is for patients to get access. So what can be done to fix a program that threatens to exclude so many? Since our pleas to the state to ease the restrictiveness of the program have fallen upon deaf ears, we will be pushing for bills instead that would directly expand patient access by adding more conditions like PTSD and severe chronic pain, as well as allowing nurses and physician assistants to certify patients. These bills would expand patient access and hopefully reduce the cost of medicine. To pass these bills, lawmakers need to know why they should support them and why they're needed so that they can vote yes on them. To that end, I planned and organized a lobby day in Albany last month that brought together 50 patients and caregivers from around the state to speak in person to the lawmakers who represent them. And this is one of the powerful ways that patients can convey why the program isn't working and why these lawmakers should pass these bills. Another way to keep the issue alive is to publicize it in the press. And for that, I published an op-ed and created a survey that patients and caregivers could take so that CCNY could get a set of real numbers to take to the media to draw attention to the real problems of the program. This is important because one of the assumptions among the public and lawmakers is that once the program had rolled out at the start of this year, patients would get access. But as I explained, this has not been the case. Finally, there's only so much that CCNY can do due to a lack of funds. The onus lies now on our lawmakers and leaders to pass these sensible, much-needed bills that would expand patient access to the program and make it one that's functional and doesn't leave behind patients in need.